Alicia is playing around without a care in the world, like any child should. But it was a different story a few days ago after a trip to a hotel and a dip in the pool.
She seemed totally fine. We went shopping afterwards, had lunch, went back, laid her down for a nap.
Then things took a turn for the worse.
That's when she started gagging and was losing breath. And we picked her up. Her dad tipped her upside down. I was doing compressions on her back. And she had stopped breathing because she had water coming out of her nose and her mouth.
What they didn't know is that she was drowning, secondary drowning. It's not easy to detect, and it comes quickly.
It's not the kind of thing where if someone's having a coughing or choking episode 4 days ago that you think, oh my gosh, I bet this is secondary drowning. Definitely if someone has it, you should have symptoms within 12 to 24 hours.
Now Alicia's mother is trying to spread the word to other parents. Pay attention.
All my friends have kids, and I warned all of them, please watch your babies after they're in any bit of water.
And Alicia's mother, Tiffany, says she had just seen a news report on secondary drowning, so she kind of had an idea of what was going on. She credits that news report with saving her daughter's life.
So, what about you? Would you know how to spot secondary drowning? Join us today to help us better understand is Dr. Yashvir Sangwan, who is the pulmonary and critical care specialist with Peninsula Regional Medical Center. Thank you so much for coming in.
No problem. Thanks for having me.
I've got a very simple question for a very complex answer. Do the best you can to help me understand. What is secondary drowning?
So what happens is that when you look at your lungs, the airway basically divides into two and then keeps on dividing till they become really small airways going into the millions of balloons that make up your lung. Now these balloons are so flimsy because that's how carbon dioxide comes into the lungs and oxygen goes out.
Which is what we're seeing on the right there.
Exactly.
Okay.
And the picture also shows you that these balloons are surrounded by blood vessels, millions of them, and the blood vessels also have to be flimsy because they have to be thin enough for the oxygen to come in and the carbon dioxide to have exchange.
Right.
Now what happens is that when you have a near drowning or a non-fatal drowning, you are submerged in a liquid, most likely water, and you have aspirated some of it. Okay. So the lungs, the way they are kept dry is because of a lubricant called surfactant.
Okay.
Without this lubricant, the lungs are like sandpaper. They cannot open and close normally. When you aspirate in water, okay, the surfactant gets diluted and your lungs stick together in a condition called acute respiratory distress.
Okay.
And so what happens is that you have to really force your lungs to open and close by breathing hard. And when you do that, the lungs again get damaged and swell up. And that's what secondary drowning or ARDS is all about.
And it affects the rest of your body as well.
Absolutely, because the lungs are big organs. And when they swell up, these chemicals that are produced, inflammatory chemicals, leak out into the body. And one by one, many organs can fail, including the heart and the kidney.
So does this happen a lot?
Well, it depends on how bad your drowning incident was. Okay. So if you are in the water for more than 5 minutes, if you have aspirated more than 4 ml per kg, so in this small kit, if you have aspirated 1/4 of a styrofoam cup, right, okay, into your lungs, that is enough for you to get symptoms. If you have symptoms after you have been saved, there is a 40 to 72% chance of getting secondary drowning. But if you are symptomless, okay, so if you go to the ER or call the ambulance and they say that you are perfectly fine, your oxygen, your heart rate, then the incident is very, very low. So it depends.
So what are those symptoms that you're talking about?
Okay. So what happens is that the symptoms are not as big as the lack of oxygen that you can see if you are in a hospitalized setting.
Okay.
But they will have trouble breathing. They will breathe hard because their lungs are filling up with water and they are becoming heavy. And you will see the heavy breathing more than anything else.
There's chest pain and cough?
Yes, cough can be there, all right, more when you are just coming out of the drowning incident, but you will see that the patient will complain of having a heavy chest or chest congestion.
So What should we do if we think that our child maybe has done that, maybe has taken in enough water to cause a problem?
Get checked out. Okay, if you go to an ER or if you go to a doctor and the doctor says that they don't think that your child has aspirated enough water and is not going to get into trouble, then most likely that can be believed. But they might choose to what you call observe them, right, for 8 to 24 hours and make sure that the secondary drowning incident does not happen.
Because it can develop later.
Yes, it can develop up to, most of the time in pediatric reviews, it is up to the first 8 hours you start having symptoms.
Okay, so we're talking about kids. Can this happen to adults as well?
It can happen to anybody who has had a drowning incident. Okay.
And there are some peak age groups.
Yes, that is for drowning. So drowning makes it in the first top 3 of any age group less than 45 as far as accidental deaths are concerned. But it peaks twice. Age 1 to 5 when the children don't know better, and age 15 to 25 when they think that they are superheroes. Okay, all right, all right. But Mother Nature is always stronger, and so you always should be supervised if you are swimming.
Right. Okay. So just be careful. What precautions should we try to take just to avoid it?
Don't go into water while intoxicated. You might think that you have 1 or 2 beers, but it might be too much, okay? Accidents, it's always about prevention. But if you have had a drowning incident, it's better to get yourself checked by somebody who knows what they are talking about.
All right.
Dr. Yashvir Sangwan.